this will be a physical assessment head to toe with my patient. There is some distraction and noise in the background, so please bear with us, and we will do our best to try and explain everything as we can. Starting out looking at the patient, we'll use this assessment to judge his mental status throughout the whole assessment, as well as we can identify his hearing and orientation throughout the whole assessment. Looking at him, we'll look at his appearance, if he's well kept, if he smells or is disheveled in appearance in any way. We're going to start by inspecting the face. His face is symmetrical, and we're going to look at the scalp and palpate the scalp, noting if there's any lesions, and everything is feeling good. There's no bumps. Can't feel anything. And I also will palpate some nose. We'll then go and examine his eyes. I'll have you remove your glasses. And we're gonna start, I'll be looking at his eyes to make sure that they are accommodating and the pupils are responding as well. So I'll have you just kind of look at my nose. I'm just going to shine a light at your eyes to see how they react. Okay, and the other side. And they are dilating and constricting appropriately with the light response. I'm now going to look inside or to the back of the eye and look at the disc back there and just examine that. If you just want to look forward, I will look in the back of your eye. Okay. Good. And it's yellow in appearance. The disc is sharp. No abnormalities noted at this time. I'm going to look at your nares to examine to make sure that they are patent, see if there's any deviation. And I don't see any deviation noted. The next thing we are going to do is look at the ears, externally noting if there is any excessive hair, drainage, earwax. You cannot see any of that right now. I will look inside the ear. Okay, that one has scant amount of wax noted in it, and we'll look at this one as well. This one has moderate amount of wax noted towards the bottom. You are still able to see the eardrum in both ears. The eardrum is white and pearly in appearance. There is no drainage, redness, or irritation noted. We're gonna look at, we already looked inside the nose. We're just gonna check the nose to make sure it's symmetrical, and it looks symmetrical. And then we will examine the mouth as well. I'll have you open the mouth, and I'm just gonna look back at the uvula, and I'll have you say ah to see if there's any deviation in symmetry when he's doing that. Say ah. Okay, perfect. If I had a tongue depressor, I could use that at this time to check a gag reflex and also to shift the tongue to look at all of the oral mucosa. I'm going to have you clench your teeth and I'll feel your jaw to make sure it's symmetrical. Good. I'm going to have you state if you can feel something touching your face. Simply say yes or no.
Yep.
Okay. Can you hear this right here? Hear this? Are they equal?
Yep.
Okay. I'm going to have you turn your head, pushing against the resistance of my hand. Perfect. And on this side as well. And I'm just looking at the muscular, when he's doing that, I'll have you shrug your shoulders up against my hands for resistance. Good. We're gonna listen to the respirations on the back. Listening to hear if there's any crackles or wheezes or any abnormalities. Everything, they're clear lung sounds throughout on the back. going to have you repeat the phrase 99. Can you state it?
99.
Again?
99.
Again.
99.
Okay. And there was no difference between each side, and it sounded, or it felt equal on both sides. I'm going to listen to your lungs on the front. We will feel the thyroid, and I'll have you swallow. And there's no sign of goiter there. We're also going to check the carotid, and we'll palpate and auscultate it as well. Using both the bell and the diaphragm of the stethoscope. Any tenderness to your nodes?
No.
Okay, and sinuses, any tenderness noted throughout your sinuses? I'm going to start listening to cardiovascular sounds. Also noting the respirations and breath sounds on the front at this time. No presence of murmurs or any gallops noted at that time. We can also, I won't do it at this time because he's holding the child, but you can also check the axillary nodes. And I'm going to listen to the abdomen as best as we're able while he's feeding this child. Listening to all 4 quadrants. Thank you. Their bowel sounds located in all 4 quadrants. Inspecting as best as I can right now in this moment. And then we will also, we can do palpation. Typically we would like the patient to be lying flat when we do this. However, we're unable to do that at this time. But palpating for any tenderness and checking masses and checking the organs as well. Noting throughout the assessment the skin of the patient, the color, if there's any scarring, bruising, redness, any abnormalities, and just seeing if there's any possible infections or concerns that we're aware of. We can also check the capillary refills of the fingers and the toes throughout the assessment, looking at the muscles and the joints to make sure everything is mobile and responding at normal strength. You can check the femoral as well when you're assessing the abdomen, just to make sure everything is normal and symmetrical. Typically what I would do is also to assess the patient's spine and back. You would have them stand up and bend over, looking at the spine to see if there's any curvature, seeing if there's scoliosis. Also, you will have the patient bend back and to the side to check mobility. Noting throughout the assessment if you see any edema or swelling, looking at the feet, the ankles, even with the arms. I don't see any edema with this patient. You can check skin turgor to see if the skin is tenting. When that was done, there was none noted. And then we just check his orientation throughout the whole thing, making sure he's answering appropriately, and his gait when he's coming in and out of the room, and making sure that it is within normal limits.